may I have your permission to use this video for educational purpose and on the internet?
You go right ahead, doctor.
Now, first of all, we have to mention that you had almost 10 months ago
Okay.
L5S1 OLLIF procedure. That is when we take the bad disc out, put the spacers in, and put screws in, and we did that minimal invasively. Do you remember the surgery?
Yes,
So-
definitely.
Now, what were your symptoms before the surgery?
Oh, I could hardly walk. I could hardly sit. I could hardly lay. My leg.
How bad was the pain?
It was severe. It was up to 10
10.
if I'm not taking medication.
Yeah.
I'm taking non-ibuprofens for it.
Yeah.
And here I'm
And
so
pain was in the legs?
Yeah, it was the right, but then it came on the left after the surgery, but that only lasted for a month.
Yeah,
and then
but
it
let's
came-
talk about that first. So,
Okay.
we did the surgery about 10 months ago. How long
Yes.
did you stay in the hospital?
one day.
Just one night?
Yeah, one
And then
night.
you told me that the right side pain got better, right?
Yes, definitely.
When did you notice it got better?
Right after surgery, when I start walking, you
But
know.
then you had left.
Yes, the
So-
left started hurting because of the surgery procedure.
What did I tell you before the surgery regarding that?
That your leg will be bothering you for a little while.
Yeah, we
until
talked about that.
month.
About 10 to 15% of the
Yes,
people get a
yes.
nerve irritation for
Yes.
about a month or two.
Yes.
And was that the same timeline that we discussed that it started getting better?
Yes,
Okay.
yes. And it's much better. It's much better, and it's gone. It went
Yeah.
away.
And they're telling me your pain is right now.
But one is
One.
one, yeah, because it depends what I'm doing, you know, and when I walk and I feel so good, I just
So you overall the surgery did help you, right?
yes, definitely. Oh, I'm so glad I had it done.
But there's still some activity that cause pain. Let's
Right.
talk about them.
Okay,
Tell me,
yes.
what activity specifically causing pain?
Like vacuuming, you know, I have a heavy vacuum cleaner, so I limit that. My
Okay.
husband does that. So
Good for you. Let him do
that. Then washing the tub, you know, get down in the tub. My husband does that because I'm bending. See,
Yeah.
I limit that.
And that is what we say, you know, if you look at those activities that provoke the pain,
Yes.
those are activities that are too much for your back.
Right. Yes.
And we are just 10 months out, it's going to
Right.
get better.
Oh, good.
But those activities have usually three things in common.
Okay.
They cause either bending, twisting, or lifting.
Yes, definitely. And I noticed that, yes. As my 10 months healing, I'm still got a little bit of it, but I'm still in the process of healing.
Yes, yes.
So, and
But
my year
overall,
is up in March 2024.
so meaning in about 2 months.
Yeah, yeah.
So now, overall, certain activity, even after that, may still cause you pain.
Oh,
You know?
definitely. I realized that because of what the procedure I had done, you know.
But as
And-
well, part of it is the procedure. But part of it is there are some activities that you know when we
Yeah,
get
I can't do, right.
when we get older,
Yes.
our spine, our body becomes less
Right.
flexible.
Yeah.
Certain activity is going to be too much. Now, you had some specific question, like you asked, can you wean your brace now? Yes, you can.
Okay, I can eliminate that.
Yes,
Okay.
and you had you have a question about some specific activity. What was the question? Let me answer
The
it.
question is that me bending, picking something off the floor, you know, that I can't do. You know,
Yeah, but-
at this point, but I bend my legs, my knees, then I can do it.
Yes, going down with the
Yeah,
whole body rather than
yes,
bending.
yes.
And those are all activities that we teach to
Yes,
you in the physical
yes,
therapy.
and I'm doing very good at that.
Good,
Bending my leg, my knees, going down, picking up, bending, going down. Instead of going forward, I go down with my legs.
I think what's important for everybody to listen to that is that certain activity, independent from surgery, will be difficult when we get older.
Of course, yeah, but my body's still pretty good.
Excellent. No,
It's
but what we
strong.
teach
I
patients,
understand, yes.
but we
yes.
teach patients that you can just modify the activity,
Yes,
achieve
right.
the same result with less stress on your body,
Right,
and that is the
correct.
goal of the
Okay,
goal of
okay,
the
good.
this physical therapy.
Yes, yes.
So I'm just quickly to turn around.
Okay.
Look that we did that surgery and bone is beautifully growing
Yes.
here and here, and they have one spacer and 4 screws.
And no
So-
loose screws.
No
thank
loose
God.
screws.
Oh, thank goodness.
But now, and so something that many of my patients ask me is about what can I do? Can I do this? Can I do
Yeah.
that? Many of those activities are so detailed that I have to watch it to be able to say if you can do it or not.
Right.
But if in doubt, to do a little of it, watch yourself for a few days.
Yes, okay.
See if your body
Right,
agrees with
okay,
that. If your body
okay.
agrees with that,
That makes sense. Yes.
then after a few days, sometimes the pain comes back next day.
Okay.
Okay?
Now, what's my limit that I can lift for my condition in my back?
If you have surgery, if you don't have surgery, generally we don't recommend for people constantly lifting more than 50 pounds.
Okay, okay.
And that is why, they limit your luggage in the airport to 50 pounds. Because if there's more than that, they have to hire two people
Right, that's
to lift
true.
that up.
Yes, yeah.
So generally we don't recommend
Just use
that.
common sense. Correct.
Yes. But immediately after the surgery, if you remember, we said 8 pounds, then it went to 15 pounds.
Yes, now
Then
25.
and then we can go slowly up.
Okay,
But whatever you're
increase.
doing, try to not to
Lift.
jump
No.
too much,
Wait.
too high, too
Okay,
fast.
Okay, I understand. Yeah.
Little by little, increase the amount of your lifting,
Okay.
and let your body tell you what your limits are. Okay.
Right. Yeah. I
So-
stop. Yeah.
Let your body guide you. It's your friend, not your enemy.
No,
Okay.
Right.
Okay.
Well,
thank you for the interview.
Yes,
I appreciate
thank
it.
you.
In that sense, I hope I never see you again. That means you
God.
don't need me.
No, I don't.
Yeah, but that's a good thing. Not need to see a surgeon. Okay.
No, that's good. Oh God, I had enough of surgeries
Yeah.
between my ear, my neck, my back.
Well, thank you so much for the interview.
Yes, you're
That was very
welcome.
good.
You're welcome.
Thank you.
Doctor.